Joining us today is Tara Posteraro. She is a physiotherapist in Sault Ste. Marie, practicing since 2011. Her practice primarily focuses on orthopedics and pelvic health. Welcome, Tara. Thank you for joining us today.
Thank you for having me.
Absolutely. So can you tell us about yourself and how you became interested in pelvic floor physiotherapy?
Sure. So as you mentioned earlier, I am a registered physiotherapist and a pelvic floor physiotherapist in Sault Ste. Marie. I have a Bachelor's of Science degree in kinesiology from the University of Waterloo and a master's degree in physical therapy from McGill University. I started my career focusing on orthopedics and took many courses over the years to receive my diploma in advanced manual and manipulative therapy. I also have a certification in dry needling, so I do use acupuncture within my practice quite a bit. I've had an interest in pelvic floor physiotherapy since grad school, but it wasn't until I had my own experience seeing a pelvic floor physiotherapist that I decided this was an area that I wanted to specialize in. For me at the time, it was the missing piece that really helped me recover from an injury that was not responding to traditional treatments. So not only has this training given me additional tools as an orthopedic therapist, but I'm also grateful to be able to provide a service to the community that can help improve one's quality of life in a significant way.
That's amazing. So it's really interesting too that it's something that was part of your own experience and your own healing journey, but then also something that you can, you've had additional training in so that you can provide this type of service to your clients too, because you know firsthand the healing power of this type of therapy.
Yeah, absolutely. That's absolutely true.
Awesome. So can you define for us what exactly the pelvic floor is and why it's important to women's health?
Absolutely. So the pelvic floor is a basket of muscles and they sit at the base of the pelvis and they serve multiple functions. I do have a model here just to demonstrate. So this is our pelvis. And if we look inside, you can see the pelvic floor and how it attaches into our pelvic bones. So firstly, it acts like a sling in order to help support our pelvic organs like our bladder, our rectum, our uterus. For example, if we have our bladder here, it would sit just right in there, right? So secondly, what it does is it helps us to maintain control of our bladder and bowel by contracting and closing around the urethra and the rectum. So these muscles are also part of our core. They help to provide stability through our lower back, our pelvis, our hips. So if there is dysfunction through these muscles, this can have a profound impact on the lower back. So for many people with chronic lower back pain, this might be the missing piece. And lastly, the system also has a sexual and sump pump function, helping to maintain tone and help with blood flow through the pelvis. So again, if there is dysfunction, which can occur with pregnancy, childbirth, aging, or illness, this can lead to symptoms of incontinence or the leakage of urine, prolapse, or pelvic pain. So pelvic floor physiotherapists have advanced training and certification in the muscles and tissues of the pelvis, allowing us to perform an internal assessment. And this is critical in identifying the tone, strength, and control of your pelvic floor muscles. And then from there, we can guide you through an individualized treatment plan to address your specific concern.
That's really amazing. And thank you so much for using the model. I think it's great to be able to see visually to have a better understanding of what the pelvic floor looks like and where that's located, because it can be a term that's thrown around a lot, but then people might not be referring to the same thing when they're talking about it, even though they think they are. And you shared so many important points, including that, it helps with promoting movement and organ function as well.
Absolutely. Yeah, multiple functions.
And even the fact that I don't think it's traditionally considered as, potentially problematic when people are experiencing low back pain, it would seem like that might be the last thing that's thought about if even, the right trained health professional comes into contact with a patient suffering from those types of symptoms that are maybe not resolving from the traditional therapies you think would resolve the issues.
Yeah, and that's always something to consider if, a physiotherapist or other health professional who does not have specific pelvic floor training, if they have patients who are, suffering from this chronic low back pain or hip pain, SI joint pain, and they're just maybe not responding in ways that you would anticipate, that this, having them referred to a pelvic floor physiotherapist could be what's going to make the difference for them, because that could be the piece that's missing for sure.
Yeah, which is so great to know, both for healthcare providers and women in our audience alike listening. Yeah. I think it's really important to think of that as a potential option instead of just accepting that, well, this is just the pain I have to live with and I've tried everything I can. There might be actually more yet that they could try.
Absolutely. Yes. Yeah.
Great. Well, thank you so much for sharing that. I'm wondering if you can discuss about what the pelvic floor's role is within the core.
Yeah, sure. So when I discuss the core, what I am referring to are the deep stabilizing muscles as opposed to the more superficial muscles such as obliques and rectus abdominis, which are more targeted with your traditional abdominal exercises. Our core involves our pelvic floor, which sits at the base, our diaphragm, which sits at the top, our transverse abdominis, which wraps around the abdomen like a corset, and our multifidus, which runs along the vertebrae of the spine. So these muscles work together in order to help maintain stability and manage our intra-abdominal pressure. So if there is dysfunction in any one of these muscles, then the systems won't function optimally. So how the system works is as we breathe in, our diaphragm should lower into our abdomen, and your pelvic floor and transverse abdominis should relax and lengthen in order to accommodate an increase in our intra-abdominal pressure. And then as we breathe out, our diaphragm moves upwards, the pressure drops, and our transverse abdominis and pelvic floor will recoil or contract. So the relationship between the diaphragm and the pelvic floor really acts kind of like a piston. As we breathe in and out, it moves up and down in order to manage the system. So the diaphragm really is our main driver of our core. So commonly what we see are individuals who are holding their breath when they're trying to perform an exercise or transition positions, or they're breathing into their chest and they're not activating their diaphragm efficiently. So this will affect our core stability system and increase our intra-abdominal pressure, which the pelvic floor cannot counter over time, and symptoms may start to present themselves.
It's so interesting to hear about the interconnectedness of all of those muscles and how they really form a system, together with the pelvic floor, because I think, again, sometimes things are thought of separately and the connection isn't always seen, but it's really amazing to hear about how they function together and just support each other's function. Because a lot of times when people think about the core, I think so often they might be just referring to like their abdomen, so just like the front of their body, and they're not really thinking about, the whole sort of 360 view, so to speak, of that particular area. And I think it's fascinating to hear too from what you're sharing that the diaphragm is like really key in that, but people don't always think about that with breathing.
Yeah, never. And it's such a simple, it should be such a simple thing, just to breathe efficiently, but it's so common where that's just not happening for people. And that's always generally step one, is to try to address that first before we can really start to progress into anything else, is just, learning those proper breathing mechanics is very important.
True. I could see how that would be a necessary first step, because if you can't breathe properly, then the rest of the system's not going to function. So you're not going to have likely the full impact of the therapy.
Absolutely. Yeah.
Totally makes sense.
Yeah.
So who might be the typical clients or patients that you see in your practice?
The most common pelvic health concerns that I see are incontinence, urinary urgency, pelvic organ prolapse, and a variety of pelvic pain conditions. For example, pain with intercourse or bladder pain syndrome, or even those with lower back, hip, or SI joint pain, like I touched on earlier, that has been chronic and non-responsive to traditional care.
Mm-hmm.
One specific population, though, are those who are pregnant or postpartum. The pelvic floor really undergoes a lot of changes during this time, and women may experience leaking of urine, pelvic pain or pressure, and diastasis recti, which is that separation of the abdominal muscles. There are things that can be done throughout pregnancy to help alleviate or minimize these symptoms and help prepare the body for childbirth. And then during that postpartum period, pelvic floor muscle training is very important in order for the body to recover and alleviate symptoms or prevent them from occurring many years later, which is often the case. And this would apply both to women who've had a vaginal delivery or those who have had C-sections as well. But if we go beyond that to everyone has a pelvic floor, including men, and everyone has a core. So, my ability to help goes beyond just one specific population. Someone experiencing leakage of urine may also have lower back pain or even chronic knee or ankle pain, and there may be a link there. So no two people are the same. So by looking at the whole person, we're able to identify those contributing factors and create an individualized treatment plan from there.
I really like two main points that you brought up. One, prevention. So to be getting care before a problem ever arises, just to at least minimize that risk, and perhaps be able to sidestep any kind of problems altogether. And the second that you mentioned that I love and I totally resonate with is the individualized care that, two people may have the same diagnosis, for example, but they may experience it entirely differently, and maybe it developed for different reasons.
Yes, absolutely. And we do that's why we have to look at the individual as a whole. And I think that's too where my underlying orthopedic training really is beneficial when treating these people, because, you can make connections between, previous injuries, whether, they had an SI joint injury years prior that may be related now, or even a knee injury that, caused some compensations up into the hip and pelvis, and everything's all related. So you definitely have to look at the individual as a whole, for sure.
True. And I think it's so interesting too that you can sort of pull those two aspects of your training together, the orthopedics with the pelvic floor physiotherapy, because physiotherapy may often be thought about as, well, a profession that you seek out support from after you have an injury or you are in maybe a motor vehicle accident, and we think about like limbs and backs. But we don't necessarily always think about the pelvic floor, and even though we can talk about it as a separate area, it's something that is totally interconnected to the rest of our body. So the two aspects of your training are very relevant.
Absolutely. And that just goes back to the pelvic floor being part of our core system. So if there is dysfunction there, our core is going to be affected, and then that can affect anything all the way down to your ankle, really.
Yeah, absolutely. Yeah. And you had mentioned something in your previous response about diastasis recti. And so this is something that a lot of women who, they might experience this in pregnancy. Can you explain exactly what that is?
Yeah, so diastasis recti, by definition, means separation of the rectus abdominis, which some people might refer to as our six-pack muscle. In fact, what it is, it's thinning of our linea alba, which is connective tissue that runs down the center of our abdomen. So this will happen in pregnancy as the belly stretches to accommodate a growing baby. But sometimes there can be straining of this tissue, and women may start to notice that they have a doming or a coning down the center of their abdomen when they're doing certain exercises and movements. And this is due to poor management of our intra-abdominal pressure, which really comes down to a dysfunction within the core. So I do teach my pregnant clients ways to manage this pressure system by learning how to breathe properly, how to engage the pelvic floor and inner core, and ways to transition and move throughout the day in order to prevent overstraining of that linea alba tissue. When it's assessed postpartum, it's important to look at not only the width of between the tissues, but also the depth. So how far can my fingers sink into the abdomen when the patient is doing a crunch, for example? This gives us a better understanding of how well the tissues can generate tension. And this is something that if left untreated, it will really compromise your core stability and can lead to symptoms of incontinence, prolapse, low back pelvic pain. So in order to rehab this, you need to learn how to properly engage the muscles of the pelvic floor and the transverse abdominis. And this will help to generate tension through the linea alba. So it is very important to get this assessed postpartum, yet you can still benefit from appropriate treatment many years later as well.
Which is helpful to know, because I think so many women may find themselves without this information until perhaps even now, and they may have experienced this issue, they may still be experiencing this issue. So I think it's great to know that even years later you can potentially still benefit. And also, I think it's interesting that it comes back to some foundational principles that you shared already, which are, proper breathing and proper movement.
Mm-hmm. Absolutely. Yeah, that's really the foundation of what's going to help correct this issue for sure.
Mm-hmm. Makes sense.
Yeah.
So what are some common obstacles that women might encounter who may be struggling with pelvic floor concerns?
So I think one of the biggest obstacles is lack of knowledge, not only about the pelvic floor, but about pelvic floor physiotherapy as a service. So I think, the majority of people that walk through my door say to me that, they never knew this service existed and that they're so happy to find out that there's something that can finally help them. So another thing too is these topics may be sensitive in nature, and there may be, social consequences such as decreased self-esteem, social isolation, depression that people might be experiencing due to, some shame or embarrassment around these symptoms. And this prevents people from talking about it or seeking help. So it's important for women to realize that they are not alone in this. 50% of women will experience incontinence at some point in their lifetime. But although these symptoms are common, they are not normal. So even, if you have had children or are aging, help is available. And that's what people like myself are here for.
I think that's such a great point that you made, with respect to some of the obstacles. They also might be in your emotional experience of the concerns that you're having. And also, I think, sometimes I've heard people, joking about these types of concerns where they don't want to acknowledge the seriousness of it, or they just don't have the understanding that it could potentially be treated. So I think it's important to really acknowledge that there are actually healthcare services that exist that can deal with these issues, so you don't have to suffer like that anymore.
Absolutely. It is often brushed off as maybe no big deal or something that's expected because, they've had kids. So they think that this is now their reality when it doesn't have to be the case, for sure.
I love that. That's so wonderful to hear. And I
Yeah.
think a lot of women will resonate with that and hopefully reach out for support if this is something that they're experiencing, because that's the statistic that you shared, 50%. That's incredibly high.
It is. Yeah. It's more common, I think, than people think. And that's why, we need to talk about it more.
Agreed. I'm so glad we're having this conversation today.
Yeah. Yeah.
So what are some of the biggest misconceptions that might surround pelvic health concerns?
So as we just touched upon, one of the biggest misconceptions really is that leaking of urine is normal after childbirth or as we age. As I just mentioned, it's very common, but it should not be considered normal. The symptom is a sign of dysfunction within the system. You don't need to live with it, no matter how long ago your symptoms started. Like it is never too late to get help. Another misconception is surrounding Kegels. So it's important to know that Kegels are not always the answer. A Kegel is a contraction of the pelvic floor, and it's often prescribed to individuals dealing with pelvic health concerns. However, there are different types of pelvic floor dysfunction. So the muscles can have low tone, high tone, or a mixture of both. So in situations where there is high muscle tone or overactivity or tension in these muscles, doing Kegels will do more harm than good, as this will increase tension further, making symptoms worse. So in this case, we need to focus first on relaxation and lengthening of the muscles in order to start to restore proper function. But even in cases where Kegels may be appropriate, oftentimes verbal or written instruction is all that is given. But there is sufficient evidence to show that this does not constitute adequate training for a Kegel exercise program, as patients just continue to do them incorrectly. So this is why proper performance of this exercise should be confirmed by an internal examination by a trained professional.
I'm so glad that you bring up the Kegel exercise misconception, because I think that is one that I've heard quite a bit. And it's not, a one size fits all, like, oh, okay, this is going to be the solution for any kind of pelvic floor issue. And again, back to individualized assessment and treatment. And I like the idea too that, you're confirming through assessment with a guided practice in office to make sure that you're doing the exercise properly.
Yes, definitely. I would say, there's a good majority of the time when assessing somebody doing a Kegel, there's compensations that are happening and they're just not performing the exercise efficiently. And in some cases, they're just not doing it correctly at all, right? Mm-hmm. So there's lots of things we have to work through in order to get them to actually engage those muscles effectively.
Mm-hmm. Sure. Another point that I want to mention too, because this is something that I've heard often as well, is that sometimes with, my female patients, when I've brought up pelvic floor physiotherapy, that might be an appropriate referral for them, that they've mentioned, oh, you mean Kegels, as if all pelvic floor physiotherapy is just Kegels and that's all there is to it. But I think you've already shared that there's so much more to it.
Yes. Yeah. And that sometimes people almost doubt that the therapy will help them because, they say to me, oh, I've done my Kegels, it's not working, right? But it goes way beyond that for sure.
Yeah. Thank you so much for bringing up that point. So how can stress potentially affect the pelvic floor?
Yeah, stress or even things like anxiety or depression can have a significant effect on your pelvic health. It can cause changes in the sensitivity of your nervous system, which can increase tension throughout your body, including your pelvic floor. And with an increase in this pelvic floor tension, you can start to develop symptoms of incontinence, urinary urgency, and certainly pelvic pain. So this turns into a vicious cycle of stress, tension, and pain that in order to break, we must address the true underlying factors. If we focus on just the physical aspects of tension, then we aren't going to understand the whole picture. Also, when pain is persistent or chronic, this might primarily be due to these changes in your nervous system as opposed to local tissue damage. So stress or anxiety may be the main contributing factor to your symptoms. So the goal is to find something that can evoke a relaxation response throughout the day. So every individual, again, will be different in terms of what works for them, but some examples might be, meditation, practicing mindfulness, yoga, or even just exercise in general.
I think that's an important piece to think about because we all deal with stress and it'll often fluctuate through our lives. So I think it's important to consider that pelvic floor issues could potentially develop or maybe even aggravate with stress and how that sort of could take place, and to keep self-care in the loop. Like, it's always something important for us to rely on, and it could be different for everyone.
Absolutely. Yeah.
So resilience is a topic that I love to talk about and is also really important to women's wellness. So what does becoming more resilient mean to you, and how does it relate to the women that you treat?
Yeah, so I think being resilient can both empower us, but also hold us back from our own recoveries, as a lot of women maybe tend to put their loved ones' health or well-being above their own. In order for us to become more resilient in our health journey, I think we really need to be in tune with our bodies and mind and actively seek an understanding of what's going on. So my role as a physiotherapist involves a lot of education so that clients can understand what factors are contributing to their symptoms, and to give them the tools that they need to be able to take an active role in their recovery. So in relation to pelvic health, as I mentioned earlier, there may be consequences such as social isolation or depression due to embarrassment or shame, surrounding these symptoms that are being experienced. So it's empowering to see women overcome these things as they start to take control of their bodies. And I think, this applies to many aspects of our health. So we need to find healthcare providers who can help us along our wellness journey.
Amazing. Well, thank you so much for sharing, that response and the connection to resilience, and also just all the wisdom that you shared today. I think it's really insightful what you had to say about pelvic floor physiotherapy and just pelvic health in general. And I have no doubt that women listening will benefit from what you shared today.
I really hope so. Thank you for having me again.
Thank you so much.